Starting in January, California, the most populous state in the nation, will challenge the notion that Medicaid is exclusively meant for the financially needy based on income and asset criteria reflecting earnings and wealth. This move may result in burdening America's underprivileged to subsidize affluent Californians. As a partially federally funded, state-operated health insurance program, Medicaid manifests as 50 distinct programs, each state imposing varying limits on resources. Although income and asset thresholds are federally regulated, different states may alter eligibility criteria. The imperfections of this system are acknowledged but deemed necessary. However, the elimination of an eligibility threshold by a state raises questions. Legislation passed in 2021 in California is set to eliminate all asset eligibility requirements, particularly for those in need of extensive long-term care. This modification opens Medicaid eligibility to individuals with substantial net worth, potentially adversely affecting those in need of long-term services and support who are financially vulnerable. Given California's substantial budget deficit, expanding government services to those who could self-fund seems untimely. As a neurosurgeon, AMD, and a hospitalist, ANM, working in a California safety net hospital, we encounter numerous patients who, despite being medically stable, require extended hospital stays due to the scarcity of facilities accepting Medicaid payments. Granting access to Medicaid for affluent individuals further strains an already burdened health system, potentially denying crucial healthcare services to the genuinely needy. While the intention behind California's move to safeguard long-term patients' assets from being exhausted for expensive care is understandable, it inadvertently perpetuates generational wealth while shifting the financial burden to the state government and federal taxpayers. Nationally, the Centers for Medicare and Medicaid Services, CMS, should take more significant measures to prevent the affluent from exploiting the system, diverting funds meant for the poor through loopholes even before states like California formalize such practices. This shift in California's Medicaid eligibility has repercussions beyond long-term care, diverting funds from other essential Medicaid recipients, such as physicians, hospitals, therapists, and pharmaceuticals. This imbalance worsens access to regular healthcare services when Medicaid reimbursement diminishes. Allowing financially capable individuals to utilize a system designed for the impoverished perpetuates disparities within the program. For numerous reasons, CMS should ensure that Medicaid serves those without alternative means to fund their health care. Changes to state Medicaid programs, including eligibility requirements, necessitate approval at both state and federal levels. The approval of California's Medicaid eligibility change by CMS without public comment is notable. Ironically, the Biden administration rescinded a Texas waiver for different reform due to a lack of public input. Congress should intervene, maintaining asset limits and reiterating Medicaid's original intent. Its most potent tool is the threat to withhold federal matching funds from non-compliant states. This issue transcends political affiliations. There are consequences to expanding the program in one area. It reduces resources available in others. Enabling wealthy individuals to access Medicaid jeopardizes access and care for the less fortunate. The federal government must step in to prevent California from exacerbating healthcare disparities with a myopic policy.